Hundreds of Canadians are resorting to crowdfunding to try and raise money for medical costs, specifically organ transplants. According to a recent study, it's quite popular in the U.S., but in a country like Canada with universal health care, it comes as a bit of surprise to some people. Joining us this morning is Jeremy Snyder. He's a health sciences professor at Simon Fraser University. Thanks for joining us this morning.
Glad to be here.
Jeremy, you were one of the authors on the study that looked at more than 400 kidney and liver campaigns on GoFundMe pages, emphasizing the financial burden that's faced by a lot of Canadians. People might not be familiar with them. What are some of the hidden costs in organ transplant?
Well, what we found out was that Canadians who are crowdfunding around this area, it's not really the direct medical expenses, but it's things like having to relocate to another city to actually receive the transplant, just transportation costs like parking and gas and that sort of thing. A lot of people who have loss of income, so they're not able to work anymore. Maybe they run through their EI benefits and then they need help with that.
Your research also found that very few of the crowdfunding pages were critical of the healthcare system for allowing patients to get to a point where they had to ask the public for financial help. Why is that a concern for you?
Well, it's a concern because I think it can kind of cover up some of the problems. So a lot of times we see people selling crowdfunding as this big solution to the problems that people are facing. But in this situation, people are told to be upbeat, be really optimistic. And so you don't see them saying, well, maybe we need to think about a system in which people do have to go online and ask for help, where the system is not helping people quite enough.
Be easy to understand, though, given the fact that they are just so focused on trying to find help for themselves. What action do you want to then see taken by the Canadian government?
Well, I think that we should take a look at this as good evidence of where maybe we could be doing better as a society, that we can be making sure that people have enough to relocate and take care of their expenses if they're not able to work. And so instead of having people turn online to ask for help for this, I think that we should try to see if some of these problems can be solved, like adding longer EI benefits. And I think another big area would be hospitals trying to waive some of these fees around parking, for example.
Yeah, Jeremy, that's my question, is for people who aren't able to raise enough money from crowdfunding, and there are a lot of people who are in that position and they're not getting help from the government. What happens to them? Where do they find the money for relocation costs and transportation, the things you were mentioning?
Well, in some cases, they're not able to do so. So there have been a couple of high-profile cases of people actually saying that, you know, I don't have enough money to relocate, and so I'm going to go on hospice care, or I'm going to sort of give up on this. And what we've seen through other studies of crowdfunding is that this isn't a really equitable way to go about this. So you'll have some people who raise a lot of money and do really, really well with this. These are people who are really photogenic, are really good at describing their needs online, children, you know, really sympathetic cases. But you have a lot of people who are being left behind by this. So it can mean that they have to dip into savings, go into bankruptcy, or in really, really extreme cases, it means that they can't get the basic medical help that they need.
All of which is very shocking in a country that prides themselves on their healthcare system. Jeremy, why did you want to do this study in the first place?
Well, what we're looking at is we're kind of interested to see if people were going online to actually ask for potential organ donors. So to try to identify people who might be willing to help with a kidney donation, for example. And we really didn't see very much of that. And so that's one of the reasons why we're a little surprised to see so many people who, again, they didn't need help actually paying for the direct medical costs, but it might be the prescriptions, or in a lot of cases, the caregivers who they need to travel with them. So once we realized that, we wanted to know a little bit more about the phenomenon. And so that's where we were surprised to find out things like the degree to which people were actually asking for help, the way that's really inequitable in how it's done. For example, people who are looking for help with liver transplants did much better than kidney transplants. We're not really sure why that actually is. And then also things like basic medications that people were asking for help with.
Jeremy
so
Snyder,
we were a little bit surprised by the depth of that.
We're going to have to leave it there. Jeremy, thanks for joining us this morning.
Thanks for having me on.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.